Reporting for Heart Rhythm TV from HRX 2022, I'm Mehak Dhande, and I'm joined by Miss Mellanie Truehills. It's an absolute honor to be in the presence of such a patient care rock star. She is an award-winning author and the founder of Stop Afib, a phenomenal organization with exceptional tools for patients with atrial fibrillation. Mellanie, welcome.
Thank you so much, Dr. Dhande. It's a real privilege to be here with you.
Of course. Thank you for your time. Now, most of our viewers probably know about Stop Afib, but for those who don't, tell us a little bit about your organization and your role in it.
Okay, great. Thank you for the privilege to talk about it. I'm actually an atrial fibrillation patient, but I have been AFib free for almost 17 years now. And once I was AFib free, I knew that I couldn't stand on the sideline and watch other people suffer. And so I started this organization. I said, somebody needs to do something. Mm-hmm. Well, it might as well be me. So I started stopafib.org to help those living with AFib to get their lives back. And that includes their family members as well.
If you want to do something well, you got to do it yourself, right? Nothing better than rolling up your sleeves and just getting into it. Now, at HRX, we've seen a lot of examples of how technology could and should help patients and their outcomes. What do you see as the role of technology in improving the quality of life, the outcomes of AFib patients, especially when it comes to engagement and education? Because as we agree, education of patients and their engagement is really the cornerstone of making impact.
Absolutely. And we found that digital health tools are really an important part of helping patients self-manage their AFib. And we do a lot of education about digital health and the tools that patients have at their disposal. And we did a survey about it and found that most AFib patients who use these digital tools, whether it be a watch, whether it be an app on their phone, whether it be a cardiomobile device, felt like they gained greater peace of mind as a result of having access to that device. And so that's a really important part of patient care, is helping them self-manage their AFib. Also, these devices are really important for those who don't yet know that they have AFib, because if we can find those who are undiagnosed but have AFib, then through the use of these devices, then we can get them educated and treated before they have a stroke.
Absolutely. I think there's such immense work that can be done in prevention and management of atrial fibrillation, and who better to pass on that message from somebody who's experienced the disease themselves. Now, I'm going to take a page out of Dr. Mehta's guidebook from yesterday. What can we do as clinicians, as investors or entrepreneurs, in order to help your mission, in order to help an organization like Stop Afib to really make a difference in patient lives?
Well, there are several things. First of all, Dr. Eric Prostowski had me come speak at one of his conferences a number of years ago, and after I spoke, he said, I just realized that a new patient appointment for AFib needs to be 2 appointments, not just one. So when a patient, that's what I'm going to go enact, and that's what he did. So when a patient comes in, he deals with the most urgent things. Do they need stroke prevention? Do they need something to manage their AFib in some way on that first appointment? Then he sends them home and says, go visit stopafib.org, learn about it, come back with your questions, and we'll deal with what the future might look like for you afterwards. And so I think that's a really important thing for clinicians to be aware of, is that in the first appointment, patients are fire hosed, and they may not be able to absorb everything, but once they've had a chance to educate themselves and then come back with their questions, they're better able to manage their AFib. So that's a really important area. Another thing I think is really important is for clinicians to have a conversation about digital health tools with their patients. Are you using them? Are you thinking about using them? And to help give patients some guidance as to what's appropriate in sending data into their doctors from their devices if they choose to get them. Because 12 rhythm strips a day is just not reasonable, but giving them some ground rules as to what is reasonable is, I think, helpful.
So highlighting the available tools, the available technology, making sure patients understand how to use it, and then getting them involved in their own care and really empowering them to make clinical decisions in conjunction with their physicians.
Exactly.
Well, that's really, really helpful advice. Thank you so much, Mellanie, for being with us and for all your phenomenal work.
Thank you so much, Dr. Dhande.
And for more content from Heart Rhythm HRX 2022, stay tuned, and we will be tuning in with live sessions as they go on. Do not miss it.